Hi there, Liberty family. I'm Dr. Angela Martin, a physical therapist with Liberty Rehabilitation Specialist. As we talk about all things diabetes this week, I'm here to show you how you can check your feet if you have decreased sensation due to diabetes, or even if you just have decreased circulation overall. There is so much to learn about diabetes and how it can impact your health, but also how you can control it. I'm excited that I get the chance to go further into detail in a weekly webinar with you guys on Facebook Live this Thursday at 1 p.m. Make sure to stay tuned to the very end because I'll answer any questions that you might have. Foot health is so important, not only for people who have diabetes, but also for people who have decreased sensation to their legs or decreased blood circulation. So why exactly is it so important? Well, first and foremost, diabetes affects the whole body and how it functions. Some of the major things that happen are that you experience a decrease in blood flow to your extremities. This can damage certain very important tissues like your skin, your nerves, and your muscles. More importantly, I'm going to focus in on the nerves. So our nerves are important because they give us sensation to the surface of our skin. So it tells us, are we touching something sharp or something dull? When we don't have that good input, we lose important information about pain and discomfort. So for example, if you have a rock in your shoe, you're no longer receiving that input about that rock being in your shoe and how it's rubbing on the side of your foot. Additionally, when we have diabetes, a lot of times we have decreased blood flow to our tissues and we have a lot more difficulty healing any damaged tissue. So again, going back to the rock in the shoe, we have a rock that's been persistently rubbing on our shoe, on our foot. We don't even feel it on our foot. Now we've got a wound that's not healing well because we don't have good blood flow to our tissue. Diabetes also affects our ability to fight infection. So again, we've got this chronic wound, it's getting worse, we don't feel it. Blood flow is having trouble healing this tissue, and then our body doesn't fight off the germs that get into that cut. So if we're not managing our foot health appropriately, we can have a lot of negative impact, including getting an infection that requires additional medication. You may need to have an additional procedure to close and seal that wound, or you may need to be treated by a wound care specialist. And in more extreme circumstances, you may lose a portion of your toe, foot, or even a portion of your leg. There are many things that can be done to control your diabetes and your neuropathy. You have a lot of power to help keep yourself healthy. One of the things that you can do is work with your healthcare provider to do sensation testing to know if you're even at risk of any sort of tissue breakdown. You also can test yourself at home. There are a couple of different sensation tests that we do. For one, you could take a Kleenex and gently just touching the surface of the foot to see if you feel that sensation or not. Sometimes doing the test yourself can be a little deceiving, so you may want to have a family member do this test for you. Now, when you see your healthcare provider, we may test for something called protective sensation. So this tells us whether or not you have the ability to feel something that might cause harm on your foot. And they'll use something called a monofilament. The healthcare provider will take the monofilament and they will touch it upon the skin until the monofilament bends. It shouldn't be painful at all. We just want to know whether or not you feel that sensation if it touches your skin. If you do not have good protective sensation, it is especially important to do regular foot checks. So now I'm going to show you things that you could add into your daily routine to keep your feet safe. First, every time you take your shoe on or off, it's a good idea to run your hand along the inside of your shoe, feeling for any rocks or things that don't belong or any sharp edges that could wear into your feet. When checking your feet, it's important that you're always in a well-lit room, and if you use glasses, now's the time to wear them. You want to be very systematic with your checks to make sure that you're not skipping any steps. First, you want to check each toenail, looking for redness, oozing, odor, any cuts or irritation around the nail bed that could be causing any issues. Next, you want to check between each and every toe, looking for any cracks or wounds that may occur there. You also want to check for bony areas on your feet along the edge of the foot and again at the ankle, both on the inside and outside, also checking at the arch. You also want to look at the base and the back of the heel as well as the base or the pads of the feet. Now, checking the bottom of your feet can be kind of tough. There's a couple different ways you can do it. One, you can put your ankle on your knee and turn your foot up to look at it. But there are also special devices like extendable mirrors that you can place running the bottom of your foot over the mirror, making sure also to check the back of your heel. Or finally, if you don't want to get an extendable mirror, you can use either a regular hand mirror or a smartphone on the picture setting. You can either use the camera or even take a video of the bottom of your foot, passing your foot over that camera while it's on the ground. Knowing how well you sense different sensations in your feet and regularly checking your feet are only half the battle to foot health. It's also important that you follow special steps whenever taking care of your feet on a daily basis. I've attached a handout from the American Diabetes Association that details the steps to taking good care of your feet when you have diabetes. I look forward to seeing you tomorrow for a more in-depth discussion of diabetes and how you can manage it. And also to give you a heads up, on Friday, Dr. Rebecca Cantu is going to go into far more detail about diabetic neuropathy and how it can be managed with physical therapy. Until then, move well, feel well, be well.